Welcome to the Omni Dental Podcast. Today we're doing a deep dive into a very specific, yet, well, incredibly common moment of confusion. It's that feeling when your gums are actually puffy or maybe a little sore after you've made the effort to floss. So we're answering the question we got: why are my gums swollen after flossing? Our mission here is to turn that little moment of irritation into a powerful diagnostic tool for you. We're going to help you figure out the difference between simple mechanical damage, you just floss too hard, and maybe the first quiet signal of an issue that needs a bit more attention.
What's fascinating here is that flossing is, it's fundamentally an act of prevention, right? But it can trigger this little alarm bell.
Alarm bell, yeah.
And that alarm, the swelling, the tenderness, that's your immune system responding to something. Our job is to figure out what exactly that system is reacting to. Is it just the trauma of the floss itself, or is the floss disturbing a pre-existing kind of silent bacterial colony?
Okay, before we really unpack the biology behind that, let's set the stage a little. Our source material for this points to a practice that is really dedicated to this comprehensive view of health. We're talking about Omni Dental and Medspa, which is located at 305 E. Rand Road in Arlington Heights, Illinois. It's a family dental practice, and it's led by Dr. Billis Poles, who has, I believe, over a decade of experience in general cosmetic and preventive dentistry.
And it's important to understand the breadth of their care, especially for our listeners in the surrounding areas. Places like Buffalo Grove, Palatine, Mount Prospect, Schaumburg. They cover everything from an emergency toothache to long-term health planning.
Exactly. And what I think really defines their philosophy, which we see reflected in the source material, is this connection between aesthetics and total health. They pair their comprehensive dental services. Everything from routine cleanings to implants with advanced aesthetic services. Things like injectables, Botox and fillers and specialized skin treatments. It's a holistic view.
It really connects back to that core idea that your mouth is not an island. A problem there often points to a larger systemic picture, and, we need to understand those connections.
Okay, let's unpack this. Let's start with the most immediate common sense explanation for why you'd be sore after flossing. I think most people's first thought is, oh, I was just being too rough.
That's the first thing everyone blames. And honestly, a lot of the time it's true. We're just dealing with mechanical irritation. If you're too aggressive, if you, say, snap the floss down into the gums instead of gently sliding it, you can absolutely cause temporary trauma.
Okay.
And that results in some localized puffiness, maybe some soreness, and probably a little bit of bleeding. It's like scraping your knee. It's an immediate physical injury to the soft tissue.
So we've established that physical trauma is a real cause.
Yeah.
But here's the key diagnostic piece that the experts really emphasize.
Yeah.
The healing time. If the swelling is only from being too vigorous, how fast should the body fix that?
It should resolve very, very quickly. If it's just mechanical, the gum tissue typically repairs itself, and the swelling subsides within a really specific window, 24 to 48 hours.
24 to 48 hours.
Yeah, and that time frame is critical. It acts as your personal alarm test. Your body is just incredibly efficient at closing up these minor wounds.
That makes perfect sense. It's a localized event. If I scratch my arm, it's not going to stay swollen for a week.
Exactly. And the recommended first aid supports this. You just switch immediately to a more gentle C-shaped flossing technique, and you use warm saltwater rinses.
Why salt water?
The saltwater acts as a natural disinfectant, and it helps reduce inflammation. It can help draw some of the fluid out of the swollen tissue, which just lets it calm down a lot faster.
Okay, so if you flossed aggressively on Monday night, by Wednesday morning, you should feel a really clear, noticeable improvement.
You should, yes.
And if you don't, then that 48-hour marker is telling us we need to look a little deeper.
That is the crucial caveat. If the inflammation hangs around for more than 2 days, or if it seems to get worse even with gentle care, the mechanical cause is off the table. Now we are looking squarely at the biological cause: gum disease.
Okay, so here's where it gets really interesting. Because gum disease is the most common reason for this persistent inflammation. The floss isn't causing the problem in this case.
Oh, no.
It's just irritating an area that was already inflamed to begin with.
And this brings us to the real culprit: plaque buildup. We use that term so often it can become a bit abstract, but plaque is a sticky, complex biofilm. It's a living community of bacteria.
A community.
Yeah, of bacteria, their waste products, salivary proteins, and it's constantly forming on your teeth.
And if that biofilm is left undisturbed for, even a day or two?
Just a day, yeah.
It starts to mature.
It matures, and the bacteria start producing these toxins. And our body, our immune system, recognizes those toxins as invaders. Precisely. The swelling you feel is not the plaque itself. It's your immune system's massive response to it. It's a process called the inflammatory cascade. The body sends white blood cells and specialized proteins to that little pocket between the tooth and the gum line to fight the bacteria.
So the redness and swelling is just a sign of increased blood flow and all those defense cells rushing to the scene.
That's all it is. So when you thread the floss through that already swollen area, you are mechanically disrupting a live battle zone. That's why it bleeds so easily.
Okay. So the bleeding isn't because the floss is cutting you.
Not at all. It's because the floss is touching highly vascular, inflamed, and very fragile tissue.
That's a really key distinction. So this initial reversible stage of gum disease is, what's it called again?
It's called gingivitis, and it is almost exclusively caused by plaque that hasn't been removed regularly. The symptoms are exactly what we've been describing. Red, swollen gums that bleed easily when you brush or floss. It can also come with persistent bad breath, which is just a byproduct of the bacteria.
It sounds alarming, but you said it's reversible. Gingivitis is reversible, isn't it?
It absolutely is. With diligent, consistent home care, proper brushing, daily flossing, and a professional cleaning, gingivitis can be eliminated. The underlying structures, like the bone, haven't been damaged yet.
But what happens if we ignore those early red flags? We keep flossing, it keeps bleeding, and we just stop because it hurts.
Well, then the battle progresses deeper, beyond just the gum line. If gingivitis is left untreated, that chronic inflammation and the constant attack by bacterial toxins start to break down the connective tissue and the jawbone that actually supports the teeth.
And that progression is called
Periodontal disease.
And that's when we cross the line from a reversible problem to a much more serious structural one.
Correct. Periodontitis leads to the formation of deep pockets around the teeth that are impossible for you to clean at home. Bacteria just flourish in there, the bone loss continues, and eventually you get the ultimate symptom, loose teeth, and that's a high-stakes warning.
Okay, let's move beyond just basic hygiene for a moment. We've established that the most common culprit is plaque, but the materials highlight a fascinating layer of complexity here. It's not always just a local issue in your mouth.
Right. Sometimes the swelling is made much worse by other systemic conditions.
This is where we connect oral health to the bigger picture of, total body wellness.
Exactly. We often think of dental issues in a vacuum, but there are several non-hygiene factors that can really crank up the dial on inflammation, making your gums dramatically more susceptible to swelling.
Okay, let's start with a big one that affects half the population. Hormonal changes. The sources specifically mention pregnancy. Why does pregnancy make gums so sensitive?
It all comes down to the vascular response. During pregnancy, there's this massive increase in circulating hormones, especially progesterone and estrogen.
Okay.
And these hormones cause the blood vessels in the gum tissue to become more porous and, more reactive. So even a small amount of plaque that might normally be fine suddenly causes a disproportionately huge inflammatory response.
So the same level of bacteria that a non-pregnant person handles easily is now causing severe, noticeable swelling in a pregnant person.
Exactly right. It's often called pregnancy gingivitis, and it's a perfect example of how dramatically systemic shifts can alter your localized immune function. It's so important for expectant mothers to be extra rigorous with their hygiene.
What about medical treatments? The sources also point to chemotherapy as a factor, which seems like a very serious connection.
It is. Chemotherapy drugs are designed to target rapidly dividing cells, which unfortunately includes the healthy cells lining your mouth. But more importantly, many chemo protocols cause immunosuppression.
So they weaken your immune system.
Right. Specifically, they cause a drop in your white blood cells, your frontline infection fighters. So the plaque bacteria that were previously being held in check can now just proliferate more freely. And the tissues themselves become weaker and slower to heal.
We also can't forget about lifestyle factors. Things like tobacco use.
Oh, absolutely. Tobacco use in any form is a major irritant. It basically reduces the oxygen supply to your gum tissue and just tanks your body's ability to heal and fight infection.
And finally, what about those other external mechanical things? Not the floss, but like braces or bridges.
Yes. Braces, retainers, even a poorly fitting bridge can create these constant pressure points, leading to chronic localized irritation. And they also create new, hard-to-clean spots where plaque can build up really fast.
This gives our listener a really clear path forward. So once we've identified the likely cause, What are the immediate actionable steps to take at home for relief and prevention?
Okay, first we focus on calming the tissues and removing the source of the irritation. For immediate relief, if it's really acute, a cold compress on the outside of your cheek can work wonders. It reduces inflammation, it numbs the area, just like icing a sprained ankle.
And for pain, over-the-counter anti-inflammatories like ibuprofen are okay.
Yes, those can help manage the pain response while things heal. But the cornerstone of relief is that warm saltwater rinse we mentioned. It cleanses, it soothes, it's just really good for encouraging rapid recovery.
Okay, now for the long term. The prevention checklist. The habits that really turn the tide against plaque.
First and foremost, you have to floss every day. Use that C-shaped technique, wrapping the floss around the tooth. If you skip a day, the plaque biofilm just matures and you restart the whole inflammatory cycle.
And brushing twice a day. Soft bristle brush, fluoride toothpaste.
Of course. And then there are the things to avoid. The advice to avoid mouthwash with alcohol often surprises people. Why is that?
It's a drying agent. Alcohol can dehydrate and irritate those already inflamed gum tissues. It can actually make the problem worse in the long run. You want hydration to support healing, not something that dries it out.
And naturally, the big health rules apply: a balanced diet and just strictly avoiding tobacco products, which, as we said, compromise every single aspect of your oral health.
And the most important step,
Professional care. You need to see the dentist regularly for cleanings. Even the best home care can't remove hardened plaque or calculus. A hygienist has to get that off to stop the cycle.
Okay, so let's summarize the severity here. Swollen gums are more than an annoyance. They are a clear warning sign. What is the final, so what if someone just ignores this?
The implication is bone loss and ultimately tooth loss. Once gingivitis progresses to periodontitis, the damage is structural and it is permanent. It requires intensive treatment, deep cleaning, sometimes even surgery. Swollen gums are your immune system's early warning system. If it lasts more than a couple of days, you need a professional evaluation.
So what does this all mean for you, the listener? It means the answer to why are my gums swollen is either a quick fix of your technique, and you'll know within 48 hours, or it's the start of gingivitis. And that requires professional help to save the structures supporting your teeth. Early detection is everything.
And that's really the philosophy behind comprehensive practices like Omni and Medspa. They focus on personalized treatment plans, using advanced tech to make sure they catch these early signs before they progress to something devastating like tooth loss. They really do see your oral health as connected to your overall systemic health.
Before we wrap up, let's leave you with one final thought that builds on that systemic link we explored.
We talked about how things like hormonal surges during pregnancy or a compromised immune system from chemotherapy can dramatically increase gum inflammation. Well, this raises an important question for all of us. How often do we really connect the dots? How often do we tell our dentist about major systemic changes in our life? A new medication, a new diagnosis, a hormonal shift.
We probably don't think to mention it.
Right. And recognizing that these total body changes show up in the mouth, well, that's the key to achieving and maintaining truly holistic well-being.
If you do need a professional evaluation for any persistent swelling, or you're just looking for preventative care in the Arlington Heights area, you can contact Omni Dental and Medspa.
You can reach their office directly at 847-483-8833. They're open Monday through Friday, 10 a.m. to 6 p.m., and you can also find more tips and advice on their website blog. Thank you for joining us for this deep dive.